Hey everyone, Kelly here, lymphedema and oncology physical therapist. In other videos, I have spoken about myths or statements related to cancer or breast cancer and what is true and what is false. But today in this video, we're going to talk about 3 different myths related to lymphedema. This is going to be part 1 of a 3-part series, so be sure to stay on the lookout for parts 2 and 3 coming soon by subscribing down below. You can also follow along with us on Instagram or on our website for more content related to lymphedema and oncology. And if you have any other myths that you want to hear more about in future videos, be sure to comment those down below. But other than that, we'll get started. So the first myth is compression garments will not stop my lymphedema from progressing or getting worse. Now, the bulk of this statement is false, but there is some truth to that. So let's explain a little bit more. False is because compression garments are the main key component to help manage lymphedema or swelling. They are used for someone who has swelling in their legs, swelling in their arms, or anywhere in the body. If someone has brand new swelling that is really mild or a new onset, such as maybe they had lymph nodes removed after a breast cancer surgery and notice a little bit of swelling in the arm, we'll use compression garments as a first line of treatment, meaning we'll put someone directly into a compression garment to help reduce that swelling and possibly even reverse that swelling. So the garments really are used to help avoid progression, and then in even some circumstances they can reverse it. The other time compression garments really are extremely important is when someone has had a lymphedema surgery. If they do not wear compression garments after surgery, a lot of times the surgery will fail and the swelling will come back or return. So compression garments really are important to help avoid progression of lymphedema and swelling. They do stretch out every 4 to 6 months, and so this is one time that this statement might be true. If someone has really old stockings or really old compression sleeves and they're trying to wear them, they might not work and someone may progress with their swelling. The other time that this statement is true is if someone is wearing the wrong kind of compression garment for what they need. And so to break this down a little bit, there are 2 major or basic kinds of compression garments besides Velcro wraps and other kinds. We're talking about sleeves and stockings. There are 2 kinds. We have a circular knit, which is a off the shelf. It's a pretty thin, basic garment. It works really well for someone who has mild swelling or lymphedema. And then we have a flat knit garment, which are oftentimes more custom, and they are thicker, they are more we call inelastic, but they do a much better job of containing lymphedema. So if someone has moderate lymphedema or severe lymphedema and they try to use an off-the-shelf circular knit garment like this one, they are probably going to swell right through it and their lymphedema is still going to progress. And so that's when it's true. If someone's not sure what is best for them, it's always best to work with a certified lymphedema therapist in your local area to find what you specifically will need. The next myth is there is a cure for lymphedema. Now, this one is a little bit confusing because there are some individuals out there saying that there is a cure for lymphedema now, which they're talking about a surgery. There are a lot of new surgeries, which we'll talk about in a moment, but they are used to help reduce the severity of lymphedema by taking out the excess tissue, reducing the volume, and improving the lymphatics and the anatomy of someone's affected side. And so this is going to improve the lymphatics. It's going to reduce lymphedema and the severity of it. However, the lymphatics at the end of the day are still dysfunctioned and they are still having issues and they still have to be managed. And so I wouldn't say that this is a cure because it's still something that someone has to maintain and take care of, but this can improve lymphedema. So let's talk a little bit more about these surgeries. There are a lot of different surgeries out there now. Some of the main ones are a liposuction, or also known as a SAPL surgery. There is a microsurgical vascularized lymph node transfer, or a VLNT, and there's also a lymphovenous bypass, also known as an LVA. There are different surgeons around the country and around the world that are doing these surgeries, and they all kind of have their own techniques. So to talk about these surgeries a little bit more, an LVA is when they take the lymphatic channel and they bypass it to a nearby vein. Because when the lymphatic vessels and the fluid's not running through the vessels, I should say, to and through the lymph nodes, they'll bypass it to a vein that is healthy, that can move the fluid up and out of that area. A VLNT, or lymph node transfer, is when they take healthy lymph nodes from an area that is not affected or that does not have lymphedema, and they transfer them into that affected area. And what happens is this is going to change the anatomy and hopefully help improve the lymphatic function of that area of the body. That's going to, over time, help reduce swelling and avoid further backup. And lastly, there is the liposuction, or the SAPL, which is used to help remove excess tissue, excess fibrotic tissue from a limb or an affected area to help debulk or bring down the volume of that region. But with all of these surgeries, someone has to wear compression garments after the surgery, and a lot of times, or really most of the time, lifelong. Some people will be able to have multiple surgeries and get to the point that they can wear a less intensive compression garment. So say like a class 3, class 4 flat knit compression garment down to a 1 or a 2, so that's not as thick or as bulky and they can move around a little bit better. Some can also get away with wearing their compression garments part-time, say during the day, and they don't wear something at night. And so again, a lot of these surgeries are meant to reduce the severity of lymphedema. They help make all of the side effects and symptoms easier to manage. And the big one is they help reduce the risk of infection. And so again, I would not say that this is a cure for lymphedema. It is a great option though to help someone improve their quality of life and their function. And the last myth for today is someone at risk or with lymphedema should not lift heavy weights or objects. This one overall is false. There is just one little tip that I would say does make a difference. But in general, inactivity or lack of movement is one of the biggest risk factors for developing lymphedema. And that being said, exercise is one of the biggest and most important components to help manage lymphedema and reduce lymphedema. We know that the muscles in the body act as a pump to the lymphatic system. Your lymph vessels don't have a natural muscle or a natural pump. They do have valves which help push fluid through, but they don't have their own pump, and we really need to rely on the muscles around the lymphatic vessels to really help and assist with the lymphatic function. And so exercise is crucial to managing lymphedema. Now, what about heavy objects specifically? We really don't want to cause any damage or an injury to an area, so that's really the only concern. Anytime we have some sort of damage or we have an acute injury to an area, we're going to push more blood flow to heal that area, and that's going to cause a further backup of the system. So we are trying to avoid that, but heavy lifting in general is safe to do if someone has been doing it consistently. So we say is gradually build up. If someone wants to lift heavy weights for exercise, start really light, gradually build up in resistance, build up in weight until they get to the point that they are happy with that heavier weight and more successful and their body is used to it. So in general, all of it is safe. We just want to make sure that someone is doing it in a smart way with gradual progression. It is ideal for someone to wear their compression garment while exercising. That compression with the muscle pump inside is really gonna give the lymphatic system the biggest boost possible. Another really great option is swimming. So the water gives a natural compression to the body. For every 12 inches or foot depth of water that someone is in, it gives a same amount of pressure, or the same amount of pressure as a 20 to 30 millimeters of mercury pressure compression garment. So the water really has natural compression. So again, exercise, movement, using the muscles in water is going to give that natural compression and give that lymphatic system a nice boost. Another really popular option is rebounding. That is using a mini tramp or a rebounder to do exercises, and that also can help stimulate the lymphatic system as well. But really, at the end of the day, my saying always is something is better than nothing, and everyone should find something that they love to do, because nothing is more important than being consistent and getting out and moving and enjoying it. I do have a lot of different videos on lymphedema exercises, including water movements or exercises, rebounding exercises, and other exercise routines that someone can check out. And I will link some of those down below or in a playlist up above. So those are the 3 myths that we're talking about today related to lymphedema. I hope that information was helpful to understand. Again, make sure that you're looking out for part 2 and part 3 of this video. And if you have any other myths that you want to hear more about, be sure to comment those down below. We'll see you all next week for another video. Thanks, everyone.